is this is an absolutely critical month, April, for this crisis. So several sources have told me that around Anzac Day is D-Day in terms of this health crisis, according to the federal government modelling on where coronavirus is at. It is then when the surge is expected on our ICU beds, according to this modelling. Essentially, we'll probably know by the end of the month just how bad a crisis this is for our nation. Now, there has been some encouraging signs on flattening the curve, as the Deputy Chief Medical Officer said there, but as Health Minister Greg Hunt described it yesterday, it is only the early stages of flattening the curve. Let's have a look at that curve again, Kieran, that you showed earlier nationally, and then I'm going to show you the two most worrying sort of states, New South Wales, you spoke about, the highest cases, and Victoria. So New South Wales, well, it's coming down, but then it's coming a little bit back up. Victoria, you can see that it's jumping around a bit, can't you? So nowhere near out of the woods yet. And as I say, the modelling shows in about a month's time, we're really going to get a sense of where we're at. If you want to know why these draconian measures are being introduced in New South Wales and Victoria, threatening jail and massive fines for going outside without reasonable excuse, well, it's all about what I just spoke about. If we don't do it, we'll be in much more trouble. Let's listen to New South Wales Premier Gladys Berejiklian and Victorian Premier Daniel Andrews from this morning with their dire warnings on where this crisis is heading.
It's only always a small minority that choose to ignore, but that, unfortunately, in a situation like this, a small minority can lead to literally hundreds of thousands of deaths.
No country in the world can have enough intensive care beds if this virus really takes hold.
Now, the political problem with this at the moment is that in Australia, at least, the health crisis is not quite tangible yet. It's like we're waiting on the shore for the tsunami and seeing how big it is and how many lives it takes. So around Anzac Day, essentially, we're going to need some more Australian heroes, and they're going to be in the hospital system. The government's economic package this week worked politically. People understood it because those lines of ordinary Australians at the Centrelink, in the queues, were right in front of us. We could see them. But we can't really see this health crisis yet. The government's already acting, though. It's been put to me that the difference between Germany and Switzerland and what's happened in those countries compared to Italy and Spain on the other side of the ledger is the former countries have had a health system able to respond. The government tells me we're ready. I mean, we have a capacity with large swathes of non-elective surgeries ending tonight. Scott Morrison made that announcement the other day. The deal announced by Health Minister Greg Hunt with private hospitals yesterday is also really key, freeing up those beds, freeing up those ICU beds. We can see from overseas just how overwhelming this has become. I mean, you've got Central Park in New York as a makeshift hospital. You've got these horrible scenes in hospitals, or in Europe and America in particular, and even young people affected, not just old people. Old people have been the vast majority of deaths, but it can hit young people hard as well. Now, let's pull up how we got this disease in Australia. We know a lot of people have come from overseas and passed on this disease. It's posted on the Department of Health website today. This very interesting pie chart about where the virus has come from. You'll see in the top right corner there, light blue. That's from cruise ships. OK, on the left up there, that's Europe. Down the bottom, it's the Americas, predominantly the United States of America. China is in Southeast Asia, just on the left of America down there at the bottom. Of course, we put the travel ban on there first. But even at that time, we were having Australian citizens come in from China. And I guess it shows they were pretty compliant in terms of the self-isolation restriction put on them there. But look at that cruise ships element to it. We've heard all the controversy about the Ruby Princess. Look, when this is all over, Kieran, we'll probably need a royal commission into the management of our borders and of cruise ships in particular during this crisis.